Huntington County natives Sydney Good and Alexis Fairchild are still recovering from the parasailing accident in Florida that left them both in critical condition. We wanted to know what trauma surgeons face behind the scenes when it comes to making life or death decisions in those critical circumstances. Today, News Channel 15's Gina Galero spoke to Lutheran Hospital's trauma medical director for a first-hand account.
The community as a whole is pulling for friends Alexis Fairchild and Sydney Good after almost a week of holding on and many more weeks to go. Trauma surgeon Dr. Donald Reed says they have a fighting chance.
If they can survive the immediate life-threatening challenges, their guardian angels looking out for them, they tend to get the right treatment at the right time and all that. They tend to have a pretty good survival rate.
He says when it comes to cases of his own, it's about prioritizing injuries.
What's the most immediate threat to life? What's going to cause the greatest long-term disability?
What he looks at first are the vessels in a patient's chest.
Like your aorta that carries the blood supply out of your heart to the rest of your body. When you have a deceleration injury, that's probably the #1 cause of death right there, is an injury to that vessel.
The next most immediate risk is a head injury.
With a closed head injury, they can immediately survive, but the long-term consequences or outcomes are much more serious.
Dr. Reed says Alexis and Sydney have a big advantage.
Bad head injuries, particularly on young people, such as these gals from Huntington, they tend to recover very well.
He says he'll have a good idea of a patient's outcome usually within the first few hours. What makes his job even more difficult is the patient's family.
That's almost as great a challenge, frankly, as taking care of the patient. Sometimes it's worse because the families obviously have a huge emotional investment. They love this person, they care for them, it's part of their life.
He wants your help so he doesn't have to make as many of these crucial decisions.
The big thing, more than any treatment, is injury prevention. You have to use common sense when you're engaged in outdoor summertime activities, be it parasailing, be it water sports, be it motorcycles, dirt bikes, regular bikes.
In Fort Wayne, Gina Galero, News Channel 15.
Dr. Reed is working to decrease summer injuries. He's drafting a position statement for the College of Surgeons to encourage stricter motorcycle helmet use.